Hi everyone, I'm Chabelle. I'm a board certified anesthesiologist assistant, and I want to cover more professional comparisons. I had a previous video where I covered comparisons to PAs, CRNAs, and doctors, and I got a DM about comparing CAAs to going into dentistry. I'm going to go into the stresses because this person was asking about specifically after school, what is the stress like as a CAA and how that compares to dentistry. So if you're interested in any of that, keep on watching. So I have friends that went into the dental field and I asked them some of their stresses and what they see, and I wanted to compare it to the stresses of a CAA. So some of my friends are graduating this year or have graduated already, and they say some of the stresses that they have are patient expectations. Patients are expecting to have beautiful smiles coming out of the dental office, according to my friend, but that's just not possible all the time. And they also can worry about doing irreversible things to patients' teeth. So that's one of the stresses that they worry about. Productivity is another stress for them. Also, the physical labor of being a dentist in terms of their neck or their back, it could be physically taxing. So that's something that over time can add to their stress. So again, the dental model, even though anesthesia and healthcare is a business, in terms of being a dentist, if you want to be in a private practice, you are bringing in patients, you are running the business sometimes. So that's a different kind of stress that you'll be dealing with running a successful business. Versus as a CAA, we don't bring patients into the hospital. We are providing a service. We're getting patients through a procedure safely and comfortably. We don't worry about bringing in patients for a lap chole or for a knee. That's the responsibility of a surgeon. So we go to the hospital and we provide the service. So in that way, we don't worry about necessarily the business aspects of practice. In comparing the stresses for a dentist and a CAA, I've had a patient that coded in the morning and then I took care of their anesthesia late at night. I was providing the anesthesia for this patient at 10 p.m. and it was an emergency case. Now that's something that I believe will be very unlikely for dentists. I don't think that they'll be typically working at 3 a.m. I had one of my preceptors that I have on social media posted that he was working, I think, until like 4 a.m. in the morning. So he was on call and he was saying that he really hopes that people take into account working late hours in anesthesia. In dentistry, some practices are only open 4 days a week. You'll work from 8 to 5 p.m. You can tailor your own hours if you're a business owner. I know of this one dentist that would work from about 12 to 7 because she was working for professionals and trying to keep her hours open for professionals that work during the day. So that's something to consider. You can have different hours, but more than likely, I believe you won't be taking call as a dentist. Possibly if you work in an academic center or if you're doing some sort of dental surgery and you have an emergency case coming in and an infection, you would have these odd hours, but it seems like it would be more common in anesthesia. However, I do want to say that it's partially a choice. I took my job and I know that my job requires call, which means I could be working at 1 a.m. sometimes. I can be working on the weekend, and that's something that I was aware of. And there were other jobs that don't require call, or even in my job, I have coworkers that will give up their call and then someone like me will pick it up because more opportunities to work, more opportunities to make money. So that's something to consider. Even though anesthesia may have some odd hours, it's not locked in that every single job will require that out of a person or out of an anesthesiologist assistant. Again, in anesthesia, you can have emergency cases. You have very critical times that you're taking care of patients. You could have a difficult intubation and it could be very stressful. So you'll have these very stressful times condensed, maybe over a matter of like 30 minutes. So for anesthesia, people consider it hours of boredom, and then there's like these minutes where your adrenaline is going and you're working very quickly and you're trying to secure the airway or get an IV on a patient that needs to get units of blood transfused. So you'll have these at times very condensed moments where you have to be very quick and your adrenaline is going. Versus in dentistry, it doesn't seem like that is as common. So that's something to consider as well. There's a lot of variability in hospitals in terms of autonomy. So you'll have different hospitals that have anesthesiologists that are more hands-on or more hands-off, but you can always call in coworkers as well if you have a difficult situation and ask for help. I think that's one of the great things about anesthesia too. As stressful as it can be, there are ways to utilize your resources to make these stressful times better. if I'm in a stressful situation, I feel like I can call out for help if I need it. So even though I might be doing these high adrenaline procedures, I do feel like there's always the anesthesiologist or coworkers that I can call to help. There is a big team, I feel like, in anesthesia, as stressful as it can get. I heard along the way that the first year to 2 years is the most stressful time you'll probably have as a provider. And I believe that would be true for a dentist as well. You're obviously learning how to become a professional. You're learning how to manage interpersonal relationships, different stresses that come along the way, and adapting to it. So that is going to be a big learning curve, the way it was a big learning curve going into clinicals. But I've talked to coworkers and they've told me that it gets a lot easier, or they manage the stress a lot better. They might still have frustrations with work. For example, if someone needs cardiac clearance and you don't have the cardiac clearance, but a surgeon might want to still proceed with the procedure, you might have to manage the surgeon's expectations on that sort of situation. So something like that can still come up down the line. So you might have stresses or frustrations even years down the line, but I've been told that it does get easier. You can feel imposter syndrome starting off, but that's part of any new job. I feel like you can start in a new hospital. You're just getting used to and adapting to the environment. It's just a lot of sensory overload. I've worked in 2 hospitals, and in the beginning of starting at these places, at both places, I was just taking in all of this information, and I was definitely more tired my first week starting off at both places, and in both situations it got better. And that's what I expect as a provider with more experience and more years, for things to just become easier and for me to manage the stress that I feel with work a lot better too. I've definitely seen that change in myself within my first year. In the beginning, I was sleeping a lot more. I'd come home and I was really tired, and now I have more time to have hobbies and go out for food, to go to the gym, to do things that are balancing my personal life. I think that's something that people just have to understand. In the beginning, it's stressful and you just adapt, and you'll be more comfortable managing it. I've asked some of my coworkers what they do to de-stress from work. A lot of people were saying the gym, running, hanging out with their pets or with their children, going to the lake or the beach. Some people like to drink a little bit of alcohol, and that helps them relax and de-stress. For me, one of the things that helps is the gym, doing some cardio, just feeling like I'm giving myself enough time to enjoy my life. Like, I'm not overworking myself. I'm not too critical on myself or too strict on myself. Even though I try to be frugal and I'm trying to pay down my loans, I also go out and eat with my boyfriend, with my friends. I go to the gym and I try to get a good amount of sleep. I try to eat healthy. Overall, good habits that honestly has helped me feel better. Being healthier has helped me de-stress as well. I gained weight during my clinical year and have been working that off, and that's honestly been helping me a lot too. Massage therapy is one thing that also helps. I know people go to the chiropractor. One thing that also helps when I'm in a situation where I've had patients that are very sick, and it's always helpful for me to continue my education and go on up to date and just like research, okay, what's the most up to date information on this illness and how to treat it for anesthesia. And so that helps me feel less stressed with the decisions I make in terms of their provider. I might not be doing flashcards the same way I was during school, but I'm constantly looking up articles and trying to be up to date with the best care for a patient. So I think that's one way to feel more assured with decisions as a new provider, verifying the literature that's out there for that particular illness or, you know, that procedure. If you're doing a new procedure, it can throw you off and you might be stressed about that, but just looking up information about that before the case, if you have your assignment before, or reaching out to coworkers. I have group chats. I have a group chat with people from my school, from my year that I graduated with, and we send out memes for anesthesia, but we also send out questions like, hey, how would you go about doing the analgesia for this particular procedure? What anesthetic implications stand out to you? I also have a group chat with some of my near graduate coworkers, and I have a group chat with my overall coworkers. I can always reach out to the anesthesiologist if I have any questions on things. If I believe I'm going to have a difficult intubation, I reach out to them. I'm like, hey, this is going to be difficult. Let's have the all hands on deck. I think that's something to be aware of, just being aware of your resources, using them, and also being aware of your limitations as maybe a newer graduate. Being new in the field, the experience that you're going to have is going to be so different from someone that's been 30 years in the field. So it's always nice to know that you have that resource to balance out any questions you have as a provider. So that's some of the stresses that I have felt as a new grad, and those are some of the comparisons to dentistry that I've come across. So if people want to see more on kind of like the mental health aspect, or if people have any sort of ways that they de-stress that they recommend, please leave that down below. I really appreciate everyone that has been asking questions, and I appreciate people that share their experience. So if you have anything to comment on this topic, please leave that down below, and otherwise I'll catch you all next week.